Hi, I'm Larry Carver, and I'm your instructor. And I'm not a doctor, and I don't play one on television, but I have a friend who hooked me up with the equipment. This lesson this time is on medical technology. Now, medical technology is a very interesting area for several reasons. The first and primary one is that it covers a wide variety of things. For example, pharmaceuticals. That's part of medical technology. You know, the aspirin was the first thing, one of the first pills that was developed that can be used for a wide variety of things. In fact, some of the stuff I've read said that if an aspirin were created today, it probably wouldn't pass the FDA. But it is a wonderful tool. I mean, you can take it in small doses to minimize the problems of heart attack. You can take it for arthritis. You can take it for other aches and pains. It's just a very good all-round pill. Now, we also have a wider variety of medication now, and if you're not sure what they are, just watch television sometime, because there's a pharmaceutical company telling you about some prescription that you can get that would solve a wide variety of problems. Now, the other thing that's changed in technology and medicine is the ability to diagnose, not only in a physician's office like this, but you can self-diagnose. For years, we've had pregnancy kits, but they've become more and more sophisticated over time. And now not only can you go to the pharmacy and get a kit to test to see if you're pregnant, you can get a kit to test to see if you have AIDS. Or you can get a kit to test your DNA, which will give you some information on your background or parenthood, paternity. So those diagnoses are available to us, but just look at the wide variety of diagnoses that are available to physicians today. The other thing that's changed is the treatment that you can get. Now, we know in treatment that sick people are much more willing to pay than healthy people. So it's an interesting thing in how we choose the treatments that we receive. Procedures have changed considerably. Look at the wide range of vaccinations that are available to people. So, you know, all of those four things have, in the terms of technology, have made tremendous strides. Now, another thing that's made a tremendous stride is the cost of getting a medical education. Med school now, on average, costs an individual a total of about $278,000. That's a lot of money. And if you consider you want to take and pay that back at current interest rates over 20 years, that's a $20,000 minimum payment each and every month for 20 years. Now, physicians, on average, a family physician across this country, the average pay is $180,000. If you consider half of that's going to go for federal income tax, Social Security, Medicare tax, state tax, property tax, and sales tax, they're probably only going to clear after taxes about $90,000 a year. That's a lot of money for some people, but not when you've invested almost $300,000 in an education. And again, that's the average across the country. Rates will vary depending upon where you live. Now, there's also a big cost for technology and research. There has been an attitude for a long time that if we can do something, it ought to be done. Let me give you an example. Hospital stays. At one time, if you had a heart attack, you were looking at a 3 to 4 week stay in a hospital. People who have heart attacks now, because of the increased technology and treatment, they're able to be out of the hospital in less than a week. At one time, if you were a child and you had your tonsils and adenoids out, they wanted to keep you in the hospital for 3 days. Tonsils and adenoids now tend to be an outpatient procedure. Another test or procedure, you know, that if it can be done, let's find it, let's run another test. Let's take another x-ray, let's send you to the lab for another test. That's a tremendous cost for healthcare. And if you're concerned about your health, you're willing to pay it, or let somebody else pay it. The book points out 3 problems that we can identify in healthcare. The first is underuse, the second is overuse, and the third is misuse. The costs of technology and research oftentimes fall into that overuse thing. if a physician has a test available, they would like to use it. And even more than that, for a patient, if they can find a test or procedure that they think might help them, guess what? They want to use it. Now, there are also legal issues that impact technology in medicine. Take a look at all the ads on television for prescriptions, and then look at the number of ads that are run by attorneys who are willing to sue a pharmaceutical company because the medicine you took may have a side effect. Oftentimes, you're warned of those side effects, but you forget about it when that side effect happens, and you're more than happy to seek out an attorney. The other thing that happens in the legal side of things is that some lawyers and law firms, I know it's hard to believe, but some of them actually troll looking for things to sue. For example, the Da Vinci machine that's used in surgery, new technology where they can do surgery that's not invasive. It has a much better rate of success, and you're out of the hospital much faster. But there are law firms looking for people who've had trouble with Da Vinci machines so they can sue the company, sue the physician, go for the big pockets, deep pockets. And the problem when you sue physicians is they have to buy malpractice insurance. And that means not only are they paying back those big medical education expenses, they're paying a lot of money for malpractice. A few years back, I had a friend who was a physician, an ENT, and he said he works for the first 2 months out of every year just to pay his malpractice insurance. Now, one of the problems I think I've identified in healthcare, and I'm not alone, is that the patient and the physician tend to have a third party involved in their relationship, and that's the insurance company. How often have you gone to a physician and they've said, we're going to do another test, and you just ask one question, is it covered? If it's covered, let's do it. So these tests tend to be done a lot because we don't have to pay for them, or some people don't have to pay for them, but there is a cost associated with that. Now, the book also points out some other things that are very important. We have an aging population. More people are getting older, and people who are older are living longer. And that's because of medical technology, because of treatment, because of procedures. But there's a cost associated with that. The other thing is quality of life. How long do we want people to live? And that doesn't mean necessarily in their 70s, 80s, or 90s, but sometimes the quality of life for someone who is 10, 12, 13, 15, we have to ask ourselves, what do we want to do for that quality of life? How much do we want to pay? I'm certainly not advocating that we remove treatment for anyone. We just have to make informed decisions about that treatment. Now, the last thing I want to touch on is the difference between an HMO and a traditional insurance plan. An HMO stands for Health Maintenance Organization, and the idea with an HMO is that you, the patient, work with the physician to stay healthy. You don't smoke. You don't drink alcohol to an excess. You don't take health risks. But most of us are more than happy to live our life as happy as we can be, doing whatever we want, and then when we get sick, we expect the doctor or the insurance company to find a medical plan that will make us better. No matter all the technology that we develop in medicine, we still have a responsibility as patients, as people, as members of the society, to adopt behaviors that will help us stay healthy. Embrace the technology as it comes, but don't get sick just so we have to use a new technology. So, as you go through the textbook and doing some research for DIGO, look for the types of technology, medical technology, and how it's changing. We touched on a little bit in the second lesson on biotechnology. There's some fantastic things that are occurring. But remember always that there's a cost for everything, not only to the individual, but also to the country. Thank you.